Hi, Chapter 9 Hospital Introduction to Hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has to come to Britain on a elite attachment to the Royal Infirmary Edinburgh. Dr. Barrow is introducing his to the hospital. Dr. Barrow, the Royal Infirmary is the name of the university hospital for Edinburgh University. Is a general hospital dealing with all types of patient and illness, accepted, accepted pediatrics, who has a specialized hospital for that in other part for fourth Edinburgh, the hospital for sick children. You can see some of the department in our hospital come the scene. Of course, there are many others. For example, the intensive care U1 and the surgical high the appendix and G, 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 Jordi. What does outpatient mean? Dr. Brown. Uh, Outpatient are the the people who come to hospital to attend a clinic or to have that or treatment and Ellen return home on the same day. Inpatient stay in the hospital for one or most day. The room where they stay are called what if a patient treatment required only one day, such as a simple operation, that they can be admitted to the to that their to that day surgery uni, units. Welcome to the Royal Infirmary. Sul entrance. Car parts. See Andy visitor and staff. The Sinsol Center for Reproductive Health. Hey, hey, necology emergency. Maternity, maternity emergency, pneumatology emergency, outpatient departments, ALWAS, day surgery units and endoscopy, X-ray department, the department, combined assessment. V. Outpatients. Dr. Barron, the accident and emergency, uh, the marmet, also called casualty, is quest patient who are accomplished he asunder serious condition come for assessment and treatment and outpatient who has a who has an, an appointment to see a specialized um, go to a clinic in one of the outpatient departments. They have usually usually being referred to the hospital by their GP would write a referral letter to the consultant and painting the patient problems. C. Inpatient. Dr. Barron. The patient in a hospital are admitted in one of three main weeks. They may be seen in one of the outpatient clinic and admit from there, or if there is a lot of demand for the treatment they need, as in the case or a his replacement, they are put on a caring lead for admission. Uh, Alternatively, the GP may arrange the admission by telephone because they acquirely ill. For example, with suspend myocardial cardiac, cardiac infection or they are seen in the A&E department where the doctor on duty were in at that time renders that mention. This will happen in the case of a patient with a fracture neck or femur, and for example, larger hospital may even have an assessment. Early warmation can be admitted temporarily while condition is assessed. Um, Jersey assets. Dr. Barron, yes, decision are made about their condition and what needs to be done to help them. After treatment is complete, the patient is the charged back to the GP care. 9.1. Complete the table with word from put a trace mark in front of the stress symbol in each word. The first one has been done for you. Verse and now. Admission. Assessment. Assessment. Discharge. Operate, operation. Referral. Threats, man. 9.2. Make word combination using a word from H bots. Accouply, lil. Assessment, unit. On, duty. Waiting, leads. feral lethal. 9.3. We hospital department will be mouse appropriate for the following patient. One, a woman in diabetes, infant intensive care unit. A patient who has used had a radical prostatation, prostatectomy, prostatomy has the appendicit unit. A patient who is to has a skin lesion ru, remove. Then they surgical unit. A man with a foreign body in his eyes accident and emergency. A woman with a turned abortion and gynecology emergency. 9.4. Complete the stack and from an information leaflet for patient information for outpatient. When when you arise, arise at the hospital, please tell the receptionist who will welcome you. Check 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 your um, details and did it. You to the wearing area. The length of your bid will depend on the treatment you are going to have. You may need to have some things such, such as an X-ray, which could may going to another department, or you may be referred to other professionals such as a physiotherapist and or the duration you may need to revisit the clinic if staff at the clinic want to see you ahead. Another appointment will be arranged arrange for you if you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery. You will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. Chapter 10. Primary Care. The National Health Service. The National Health Service is responsible for health care for everyone in the United Kindle, although a small number chose to pay for private care. Treatment is free, but there is a prescription charge for shocks and abiances, such as a cervical coil, with a section for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sonatis known as family doctor, nurses, these pharmacists and apothecian GPs were in practice for in practice of one on in practice of unto 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 20 practice a base in a surgery and look after the health of from 1,000 to 15,000 people in their local community. They also uh, provide health education in areas such as self as as smoking at day at day at day clinics um, and die and die clinics. His vaccination, for example, for influenza and may perform minor surgery such as removal of warts and molds. If a patient needs specialist care, the GP will need a refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Uh, home home visits are made when patients are housed both unable to leave their homes or too ill to attend surgery. Out of um, over over treatment from 6 p.m. to eat a improvised by the local um, Remali Trons, which organize and chief of GPs and locums GPs to cover if someone is absent. Um, and note, the note surgery has trained meaning. The bulletin word, GP's word, the practice has moved to any surgery on the high street, a time when GP's inspection. Morning surgery is from 8.0 to 12.0. The work of surgeons, you the patient needs urgent surgery on a blunt appendix. V. The prostituting. The prostit the prostituting. A typical GP prostituting employing receptionists. They are responsible for initially initial a patient contacts, making a payment and taking requests for repeats and prescription, taking meds from patient and the other healthcare providers and providers and for filling and scanning document into record. The practice manager has responsibility for finance and sometimes for it. Supervises recession staff. His, his locums and health prepares the practice, developments plan. Practice nurse room practice nurse room asthma, diabetes, and cardiovascular disease clinic as well as one-to-one clinic for those who wish to give of smoking. In addition to practice staff, GPs work with a number of well professionals. District, district nurses be temporarily hold bone patients such as recently discharged hospital patients to chance and dressings such as ulcer dresses. Help visit families to carry out check-ups on young children and particularly undefined to make sure they are healthy. Special attention is paid to families in name, such as those living in poverty. They also do, do baby immunization. Um, Midwives run clinic for antenatal patient. Physiotherapists physiotherapists provide hands-on training, but also teach patients exercise they can do to improve their condition, often an accident or operation. C. A GP day. Dr. Stewart worked in a practice in a small market town with three other doctors. The surgery is in the center of the town. The eats Charles by three practice. The, this is a typical working morning when she is not the duty doctor responsible for emergency and urgent problems. 10.1. Complete the sentence. Children over 60, 60 and people with some chronic disease do not have to patient respondation charge in the United Kingdom. 2. Patient with patient with mobility problem may be unable to walk out. They are housebound. 3. A the parent the parish GP appointment is 10 minutes long. 4. Allow GPs in someone who takes the place for a task member who is on leave. 5. Care, care out and side working hours is now as out of hours trauma and trauma. 10.2 may work combination using a word of process from age, but one word can be used twice. And change dressings, make appointments, make home visits, perform minor surgery, refer a patient, run a clinic, supervise staff, take message. 10.3 with men we member of a practice team and a practice team would be responsible for each of the following. 1. Running a clinic for program women meets whites. 2. Teaching a patient how to strengthen his broken limb physiotherapist. 3. Learning the GP now that a patient can come to her appointment receptionist. 4. Running a clinic for people uh, who, who want to learn weight practice nurse. 5. Visiting a patient who has just returned home after a after a hernia operation. District nurses carrying carrying out check ups on children in outport and neighborhood health visitors organizing cover for an Abser doctor practice manager. Um, um, 10.4. Complete the diary for Dr. Stewart after room. One out, one out to pin practice, thing mirroring over sandwich long. To add 4 p.m. afternoon surgery 12 10 minutes appointment. For at for to for 20 p.m. comfy week. For 20 at 5 p.m. check with reception for message deal with home visits and repeat recreation rec- recruits 5 at 6 p.m. Paperwork and referrals to secondary care admin tasks. Telephone calls to patient provide medical examination seats PM for funds squished to out of hours service. Chapters 11. Medical Education 1. Medical Education in the United Kingdom. Medical Education in United Kingdom covers undergraduate education for 4 or 5 years at medical school. The surgeon of the university responsible for medical education a two year from year foundation program which provide training for new doctor after graduation through a series of placements in different specialized postgraduate training with doctors take to become GPs or consultants and senior specialists, often delivered from college for different specialized. For example, the Royal College of Physicians. Continuing professional uh, development in the front of calls and seminars which doctors undertake through throughout their their working life to keep up to date with Stru- Stuart from at Stuart from an undergraduate prospectus. The the Bachelor of Surgery is a 5 years un, under undergraduate medical and degree course. Much of your learning takes place in small groups. The main components are core years with core, core years one at three and integral program of clinical and scien- scientific topics mainly present through problem by say learning period where you work with other on a series of case problems. Students set modules. Students set module out allow you to choose from a menu of students such as sport, medicine, or even a student a language as preparation for a for one oversight and elective, a hospital attachment of of your uh, and choice visiting year 4 and 5 vocational students and clinical skills. This this component prepares prepares you for the clinical skills required for contact with patients from years one of your course through, through period of practical training where you are attached to a hospital, department, or general practice. Clinical attachment year of and 5. A series of 4-week clinical attachment in medicine, surgery, and physiological physiological medicine, child health, obstetrics, and gynecological and general practice. C. A student view. Ellen, a medical student, describes her course. I am youth I am youth finish my first year of medical. What I like about this course in that you are involving with patient from the from the bearing beginning. Even in our first year first years, we spend time in hospital. Much of the course in PVL, we have to order session a which were week were in groups of with to 10 solving clinic problem. We decide to header how to tackle the problem, look of books and online sources make note and discuss the case together. It's a great way of learning and hearing to know the other student. In the past, medical students had lectures with the word class taking note from lecture from 9 to 5, but now it Melvin group work. Also, we do have some lectures and seminars work with work in small groups with a tutor. I like of it, it even the session. We had to cut a cadaver from the second month of the course. 11.1 Match these degrees to the stage of medical education in the United Kingdom, even in age uh, opposite. One, one, this dissection cadavers undergraduate. Two, keeping a lot of surgical procedures observed and performed postgraduate. Three, working from working of working for 4 months in accident and emergency to experience the specialized foundation program. 4. Taking a 4 week attachment in obstetrics and gynecology undergrad, under, undergraduate. 5. Taking an online course on present development in cardiovascular design, continue professional development. Um, 11.2 Complete the sentence. Youth, youths before their final year student have the chance to take an electric in a hospital of their choice anywhere in the world. And problems learning eh, based learning contrasts with an approach where a subject is is taught expertly. And these days, lectures are often alternative with regular opportunity for the student to ask a question. In the clinical attachment, a student learns how to treat a minor patient. Students should uh, modules and be a topping from outside medical such as a foreign language. dissection of cadavers is an important part of the anatomic component. The medical school at University of Edinburgh in one of Oldens in the United Kingdom. She's a consultant at the Royal one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh, Edinburgh days from 1505. We have a seminar age week where we discuss topics in a small group with our lectures. 11.3 11.3 March age of these activities to one of the component of the undergraduate chorus described in the opposite. Uh, Julie spends 6 weeks working is a small hospital in the Emilias oversized electrics. 2. A group of students discuss together the possible reason for abdominal pain after meals in an obsessed 14-4-year-old main problem and beside learning. 3. A small group of students trains the pulmonary artery in a cadaver dissection. 4. Otto spends a month working in the parametric ward of the local hospital clinical attachment. 5. Anne learns how to take blood from an elderly patient clinical skills. 6. Yuma chooses to study tribal medicine in his 4-year student salt module. Chapter 2, Medical Education 2. The Foundation Program. The Foundation Program is a year's training program which form the bridge um, but- between university, level study and medical school, um, and specialist or general practice training. It consists of a series of classes age lasting 4 months, which allow the junior doctor now as training to sample different specialized, for example, pediatrics. A year one training FY1 corresponds to senior half officer posts. Age training have education supervisors. Uh, whoever who's that more senior doctor level training in different grade include clinical and educational supervision. To progress, training has to demonstrate a rank of medical competency which are assessed through observation in their workplace. Um, v. People in medical education. Tutor. Ac- an academic or in some an academic or in some case a postgraduate student whose lead tutorial demonstrator in anatomy teaching someone who demonstrate how to dissect. Demonstrator are often postgraduate students paying their way through medical school, lecture, and academic which teaching in Richard responsibilities who scribbles to to the teacher of a particular discipline. Professor. A senior academic with teaching and research responsibility for a particular discipline, usually a leading figure in their discipline. College tutor, a consul responsible for delivering a college training program. Clinical trainer, a consultant assigned uh, to a trainer who provides during a period of direct clinical care, educational supervisor, a consultant who supervises a trainer's period of training. C. Medical qualification. BNSC, B, BNSC, BNEDSCI, Bachelor of Medical Science, a degree obtained take take after 3 years of medical student by a student who may wish to follow a career in medical. MBCHB, MVVS, VMVCH, VMVS, VMVS. Um, Bachelor of Medical, Bachelor of Surgery, Bachelor, Bachelor degree are undergraduate degrees, degrees. D is the first degree for January, January, United Kingdom doctors. ND, Doctor of Medicine. DRCO, DRCOG, Diploma of Royal College of Obstetrics and Gynecology, NRCP, member of Royal College of Physicians or, no, or member of the Royal College of Surgeons. Dr. Vicom, Dr. Vicom, members by member 5, member by successfully completed the assessment procedures in their college. FRCS, Fellow of Royal College of, of Surgeons of England. Other colleges are indicated by the letters which follow. For example, um, Edinburgh, um, Glasgow, or or Iruiline, who Dr. Beacon a follow depends us on their college. For the FCS, further examination must be passed. For other college, it is by nomination or work assignment. 12.1. Complete the phrase which bears from the box. To phrase can be complete into inferring uh, ways. Access, deliver, demonstrator, um, provide, supervise, take. Demonstrator 1. Demonstrated a competence or how do to something. 2. Supervises a training by ensuring the successfully completes her training. 3. Deliver a course or a training program as a teacher. 4. Take a course uh, or a training program as a student. 5. Assess progress or competence. 12.2. Match the parts of the sentence. 1. An FY1 is a Doctor D in the first year of the foundation program. 2. A demonstrator is an anatomy teacher age who teaches this session. 3. A clinical trainer is a consultant F who provides training during uh, during period of the clinical care. 4. A supervisor is a consultant B responsible for the training program of a training. 5. A medical school is G part of a university responsible for a medical education. 6. A placement is C. A period spent as a training is a hospital for in general practice. 7. A college is a body of specialized responsible for delivering and essences training in their specialties. 8. A, a fellow is a specialist who has um, who has reached the highest level in their specialties. 12.3. um, Grade in food the qualification of doctor and surgeons. Mr. H. uh, John Hisby and VCHV. Bachelor of Medical, Bachelor of Surgery, Fellow of Royal College of Surgeons of England, Fellow of Royal College of Surgeons of Bibriline. 2. Dr. Dillon, VNED SCG, Bachelor of Medical Sciences, Doctor of Medicine, member of Royal College of Physicians. 3. Um, Mission, Mrs. E. English and VVS, FRCS. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons, Doctor. uh, 4. Dr. E. Merriweather, and VNDFRCP, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Chapter 13. The Overseas Doctor. A. Type of Type of registration. To name to name and train patients in the General Kingdom, a doctor must register with the General Medical Council. There are several types of registration. And provisional registration is the for doctor who has you qualify from medical school in the United Kingdom or from Central European Academic Area members state. Full registration is a for doctor who has completed their year clinical training. limit registration is for the national medical graduate who has not complete the equivalent of the year clinical training in the United Kingdom. A specialist registration is for doctor who has completed a specialist medical training and have a certificate of 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 complaining complaining of training. The GP register is a register of all those eligible to work in general practice in the NHS. And V. PLAB. Before they can obtain full registration, some categories of oversight doctor are are required to take to professional and linguistic assessment and board dates. PLAB in design to uh, ensure all pupils can practice satisfy at the level of and as each all in offered appointment in United Kingdom hospital. Part one consists of weighted tests of nausea, skin, and attitudes. And attitude is a urgent structure clinic as at CM. At CM ration out as CE 8 consists of a consists of 5 minute clinical examiner ex, scenarios known as a station to assess professional skills. C. Plot station and advice. OS CS assess the scale. OSCS assess the scale. Clinical examination. Your ability to carry out a physical examination or a simulate patient and actor trained to play this role will be assessed. Un color, un comfortable or intimate examination will be carried out using a mannequin and anatomic model. Practice skin. Practice skin. You will be asked on practice skin such as suturing, in wearing, intravenous injection, communication skills, your ability to interact with a simulate patient, or in such cases, the examiner will be asked skills Tastes, skill taste may include drinking, but new and giving and buy on lies or lies dice. History taking. Your ability to take an accurate history and make a, a resumed diagnosis will be assessed. Um, advice advice on the station from a successful candidate. Read the introduction and upside age station careful who have 1 minute for this. Don't forget the AVC airway is breathing circulation protocol in emergency station. Keep in mind, keep in mind safety uh, mm, pro, precaution like throwing the chaps in the chaps being chap the patient under 13 while it happening. They ask the about any consigners they may have. Don't you have a lecture listen uh, careful to what the actor says? Note, charts needles and blades which must be disposed of safely in a special container. Um, 13.1. What kind of the registration uh, might this doctor obtain? One, a newly qualified Spanish doctor provisional registration. Two, a newly qualified Nigerian doctor limit registration. Three, a doctor who has successfully complete the first foundation year full registration. Four, as an each all who has successfully complete the foundation program and handed a certificate of completion of training after general specialist registered both specialist registration. 13.2 uh, right no Great the abbreviation in words. Uh, any doctor who want to the work in the United Kingdom must register with the GNC General Medical Council. Two, some overseas doctor must pass a PLA test before they went registered professional and linguistic assessment board. 3. Part 2 of the test consists of the OSE objective structure clinical examination. 4. AM emergency remember the ABC uh, protocol emergency breathing qualification. Emergency breathing circulation. Excuse me. Um, 5. Before you can obtain a specialist registration, you must have a CCT certificate of completion of training. 13.3 Complete the text. My name is Musa. On, I come from Yemen. I come to the United Kingdom about 2 years ago after graduate because Yemen is outside the EEA. I could only obtain limit registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the lab test to show that I could work safely in the United Kingdom if I had to have some ad, advice to other candidates. It 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 would be that at counseling station you children simple memorial ascent of races. It's better to really think about what you are saying to the actor and have the intonation right. After completing after completing my year clinic I was able to obtain full registration, but I found it difficult to have an SH of both in my chosen, especially pediatrics, as a hospital now has to demonstrate there is a soil suitable uh, candidate from the from the from the a from the EEA. Once I complete my second foundation my second foundation year, I should obtain a CCT, which will allow me to proceed to a specialist registration with the GNC and important ethics on the road to becoming a pediatric consultant. A pediatric consultant.